Ready. So we are on Facebook Live. Yes, we are. I think. Yeah, we're there.
Yeah. We need some music.
All right, excuse me 1 second. I'll be right back.
Dr. Diaz, I don't know if you have Dr. Buller's text cell number. I have his email, can't seem to find his cell.
I'm pretty sure I do. I'll text
Okay,
him.
thank you.
Oh, there he is.
Mention your name and you appear.
Hey, Martha. Hey,
Hi.
Pastor Best.
Hello, Dr. Buller. How are you?
Good, good. How about you? You good?
I'm well. Thanks.
Nice. All right.
I believe we're on Facebook Live, so
Yes,
just to
we
let
are.
you know.
All right. Sounds good.
So it's just now 6:28. So we'll give it a couple more minutes and then we'll start. We've got to be considerate of you and Dr. Diaz's time.
I'm good.
All I know is I could use some air conditioning tonight. This is like a surprise.
It is.
Yeah.
I don't
Not
even-
crazy.
I don't even have my shorts or
That's-
anything out yet.
I think that's why Dr. Buller doesn't mind staying at the hospital. He said,
Mhm.
well, I've got air conditioning over here.
Yeah, it's
Exactly.
nice and cool in my office. We had a going away party for a couple of our ICU APPs over at Boca. So I was out and then came back over here after that. We had it outside. It was warm out there.
Yes, nice day for it.
Yeah.
I'm just enjoying all the spring flowers.
Yeah.
Yes, I'm glad I don't have allergies, knock on wood.
I do. Year round.
Sorry.
Yeah, I'll develop some sneezing and coughing when the pollen gets really tough.
Yeah, I do as well, but I still enjoy the flowers. so.
Exactly.
Dr. Buller, Pastor Best is going to post this on Facebook after the event, so just FYI.
Sure. No, thanks. Yeah, good idea, Pastor Best.
Thank you. Yeah, like me and Martha were talking, we know people may be just like over COVID now and just
Oh, yeah.
like tired of it, but you know, it's still there. That new variant that's out, that's in what, 20 countries from what I heard last week.
Yeah.
So I don't know.
Well, you never know.
Yes.
Yeah.
Well, it's 6:30, so I'm going to record this as well, Dr. Buller. Is that okay with you?
Absolutely. Sure. Yeah.
Okay. Well, here we are. Good evening to everyone who is joining us. I am Pastor Aaron Best, founder and senior pastor of St. Matthew Baptist Church here in Bridgeport. And we are doing a COVID-19 town hall meeting with Dr. Magna Diaz and Dr. Gregory Buller. Before we get started, we do have some housekeeping, and that is please keep yourself on mute so that the doctors will be able to give a full report on what they know and that they are not interrupted. And also, if there are any questions, please write it in the chat. And during chat time, I will read the questions off to Dr. Buller and Dr. Diaz. And just going into some COVID information, as per the Connecticut Department of Health, the Connecticut COVID-19 positivity rate today is 3.21% and 5 COVID-related deaths. COVID-19 positivity rate per the Connecticut Department of Health for the city of Bridgeport is 1.27%, and with 8 new cases over the past 7 days. If you have any further questions or concerns, please contact Yale New Haven Health call center at 1-838-275-9644, and I will put that number also in the chat so that you can have it between the hours of 7 a.m. and 7 p.m. And now I will turn it over to my co-moderator, Martha Judd from Bridgeport Hospital. Martha.
Thank you, Pastor Best. Tonight, I have the privilege of introducing our 2 physician speakers. I'd like to start first with Dr. Magna Diaz, who is the chair of pediatrics at Bridgeport Hospital and the regional medical director for inpatient pediatric services at Yale New Haven Children's Hospital. Prior to this role, she worked for the Children's Hospital of Philadelphia for 20 years in various settings, including as medical director at several community pediatric hospital programs, and she founded the Pediatric Urgent Care Network at that hospital. She's been a pediatric hospitalist since 1999. Dr. Diaz is also a professor of pediatrics at the Yale University School of Medicine. Outside the hospital, Dr. Diaz enjoys spending time with her 2 young adult children and her husband, who also is a pediatrician. As a family, they are all black belts. She also enjoys cooking, traveling, and reading. Our other speaker tonight is Dr. Greg Buller. Dr. Buller received his undergraduate and medical degrees from the University of Kansas and then completed his internal medicine chief residency and nephrology and hypertension fellowship training at Duke University. He then came to the Yale system, where he is currently the clinical professor of medicine and also the chairman of the Department of Medicine at Yale New Haven Bridgeport Hospital. He's also the associate chief medical officer. He has received more than 20 Yale teaching awards and is the author of more than 100 scientific articles. Dr. Buller is a former professional tennis player and an avid skier and road racer. So without further ado, I'll turn the program back to Pastor Best and our speakers. Thank you.
Thank you, Martha. So what we're going to do now is, if we will, Dr. Buller, if you would like to go right into where do we go from here with COVID? I mean, here we have masks are coming down. Some of the the mandates are going to be ending next month in a couple of weeks. Actually, I believe May 11th, the mandates will be ending. Do we get vaccinated? Where do we go from here with COVID, and how can we live with this?
Yeah, thanks, Pastor Best. I mean, everybody obviously realizes that there has been a really significant reduction in how many people are, clinically importantly infected with COVID. Trust me, there's plenty of COVID still around. People are being exposed to it and becoming infected with it, especially any new strains that come around. But there has been the development of a significant amount of immunity, and that immunity is due to really 2 main things, right? One is vaccination, particularly those individuals who have received both the original vaccines and then been boosted. And then also the fact that probably almost everybody has actually had COVID and has developed a significant amount of immunity. And again, the immunity is not just antibody immunity, that are measured, and you can measure that in blood tests. And we know that antibodies wane, or they drop down over the course of time, usually months. But then you also have this kind of immunity that remembers. It remembers that COVID is a foreign invader to the body and is able to very quickly mount an immune response. And so in that regard, there is some degree of so-called herd immunity in the population, and is helping along with receiving booster shots, vaccinations, and keeping the clinically important, in other words, those people who get really sick and come to the hospital, keeping that incidence very, very low. Now, there's still people who get plenty sick with it. And who are those people? They're the people who have abnormal immune systems, are over the age of 65 to 75, are significantly overweight, have diabetes. All these risk factors can put a person really at very significant risk still for COVID, because especially if their immune system is not working normally, they're not able to mount this immune response, so they don't really get either type of immunity to any great extent, and they don't respond nearly as well to vaccinations. So there's a group of people out there who still remain at really significant risk. Magna, do you have some further comments?
Yeah, I would agree. I mean, I think overall, it's good news that, numbers are dropping. But I think it can't be emphasized enough that while numbers have dropped so much, and we were in really a remarkable phase of my medical career in terms of how many kids and adults were hospitalized for this disease, having family members who died from this disease. And I think a lot of people share that experience. And we're not in that phase right now. But I think it's important to remember that even in this low phase, there's still about 150,000 people every year dying of COVID in the United States. And if you compare that, for example, to things like the flu, that normally kill about 20 to 40,000 people, so a lot, but this is a lot more. So if this is kind of our low state, we do have to be worried for some of those populations that Dr. Buller has talked about.
And then just to reiterate the need for vaccination, or when do we get vaccinated again?
Mm-hmm.
It seems like the recommendations are going to be the fall, concurrent with influenza vaccine. So just kind of look towards that. Now that may change. Pastor Best, as you pointed out, there are some other variants lurking out there.
Mm-hmm.
If they make their way here into North America, we may well be experiencing them sooner than we might otherwise experience them, and may cause us to change that recommendation. But for now, that's what seems to be what's going to happen, is get another booster vaccination, trying to target the most prominent type of COVID that's out there, kind of similar to what we do with influenza,
Mm-hmm.
and administer that in the fall.
Well, I mean, last fall, when we were going into the fall last year, I had made the comment to my congregation that here we're going into fall, Thanksgiving, so expect the numbers to go up. It's not that I didn't know what I was talking about. As a lay person, I just took the information from the CDC and how it happened the year before and how the numbers just climbed. So I took that information and provided it to my congregation. There are few people who said, well, Pastor, you're not a doctor, so you shouldn't say that. But a layperson can see that that's what actually happens. And it happened. The numbers went up in the fall. We were all in this place together, all confined for the holidays, Christmas and Thanksgiving and New Year. And then afterwards, everything started to drop down some. So would you, either of you, keep recommending that pastors or keep telling people in their bulletins about COVID, stop telling them? I mean, for me, I think it is much more informational to do that, so that the older people in the congregation will know, and the ones who got kids, because pediatrics COVID is worse as well, isn't it, Dr. Diaz?
Yeah, I think that there's two things that are worse about it. One is that, of course, our very, very young kids, so the kids who are under age 1, are at risk for pretty severe disease. And so it's important to protect them. And the other reason is because when you develop complications and you're little, right? And some of these complications can last for your lifetime,
Mhm.
that makes a big impact. I mean, if you're, 100 years old and you get a complication, there's only a short lifespan. But if you're 1 and you get a complication, that can have a significant impact for that child's life.
And when we gather together now as a pastor, I've had questions. So how do we, can we should we still distance off? And I think Dr. Buller, you and I said this to you. Should we distance off, and the hand washing and the temperatures and the masks? Do we still go with these mandates? Do you guys think that's the CDC is going to come out with different mandates for, as we move forward with this?
This is a difficult, this is a difficult question, but the question to ask. I mean, no doubt about it, and particularly, about your congregation and churches in general, because remember that the initial infections that were identified in New York, which was, some of the first infections were there,
Yes.
were traced back to a church congregation.
Yes.
And the initial death, actually, one of my own faculty members was at that, participated in that church. And everybody's packed in. I mean, I'm not telling anybody here, anything they don't know. And, the ventilation, the number of air changes may be reduced, relatively speaking. And, so it's certainly increases the risk of transmission of COVID. Now, to me, the major risks are those individuals who have abnormal immune systems and are older. Mm-hmm. Those individuals should, when they come to church, they should wear masks. What can I tell you?
Right.
Everybody should practice good hygiene, hand washing, et cetera. This just makes a lot of sense. Something that's kind of learned just how effective that actually is. So the combination of masks and hand washing, using, either soap and water, of course, the alcohol, washes. I think those things are really necessary. And anyone who feels uncomfortable at all should be allowed to wear a mask and not shamed to wear a mask at all. So, I think it's kind of one of those things you take on an individual basis. Healthy people who've been vaccinated, who maybe have had COVID once or twice, it's hard to rationalize them, wearing masks. Although patients of mine who fit that description, who interact with their elderly parents or around individuals that have normal immune systems, I encourage them to wear masks and be very cautious about, washing their hands, et cetera, and wear masks around their loved ones who are at risk.
Dr. Diaz, what would you say to a pregnant mother or a mother with small children in regards to COVID? I mean, what advice would you give to them?
Yeah, I'm going to just add one thing to Dr.
Yes.
Bullock's comment before we go on to that question. And that is that if, I firmly believe that it is important to congregate and especially, to praise God. I think the thing that is really important, though, is that if you are feeling ill, don't bring that, right? That's a time to stay home. Even if you have no risk factors, you don't want to expose other people who may not be able to protect themselves. In terms of your question about pregnant moms and children, I think that that's a really important question. We know that pregnant mothers are at increased risk for themselves to get sick. And we also know that their fetuses, their babies that are inside of them can have more complications if they get COVID during pregnancy. So I would say for pregnant moms, just like we recommend the flu vaccine while you're pregnant, this is a vaccine that has fortunately had a lot of studying in pregnant women because we've had to, right? We didn't know, and we knew that the risk was high for those moms, and it's been shown to be very safe. So I would say go ahead and get vaccinated. It not only protects you, it protects your baby. And even after your baby is born, if you're breastfeeding, it protects your baby from getting sick as well.
One thing I want to say before we continue, if there's any questions, please write them in the chat. I do have some questions here. When we get to Q&A, I will read the questions off. So don't think that I am not going to read your question. We have a time for the Q&A, but if there are any questions, please write them in the chat. Thank you. So how can I say, can either of you please, or both of you please, express that the vaccines are safe to get? I know within my community, we have this stigma of not trusting doctors and vaccines because it was too quick and this, that, and the other, but it saves lives. And I can't say, I can say it, but hey, I'm just a pastor, coming from the medical profession. Please elaborate on the vaccines for COVID.
Yeah,
Go ahead, Magna. This is your
I mean, I
your
think
area.
we definitely have. I mean, maybe in the beginning, we knew a little bit because we tested it on a small number of people before it was rolled out. So I get it. But now we've had millions of people, more robust looking at this scrutiny on these vaccines than any other vaccine in history, and more data over the past 3 years than vaccines that we've had for 20 years because of how compressed everything was in terms of people getting this vaccine, in a shorter period of time. So I feel incredibly comfortable saying that these are safe vaccines, not only for adults, but also for children. And if I didn't feel that way, I wouldn't have given them to my own children nor taken it for myself.
I mean, there's no doubt that there are some side effects that occur with the vaccines, but the side effects in general are extremely minor. This has got to be the safest type of vaccine that's been identified. And if you look at those side effects, like let's take some that people might be worried about, like inflammation of the heart or the lining of the heart. The actual incidence, how often that happens due to the vaccine is incredibly less than how often it happens due to COVID. Right. So every single potential side effect of the vaccine is something COVID may cause, and it causes it tremendously more often than the incredibly rare times that it's related to a vaccine. So you're definitely better off trying to prevent COVID, and we know that the vaccine is the single best thing to prevent a COVID infection. It is really spectacularly effective.
Now that the mandate to get tested has stopped and winding down on May 11th, here where I live in the north end of Bridgeport, they had a COVID testing site done by Wren Laboratories. And I mean, because I am in the public, I am in the congregation, I went over there almost every 2 weeks to get tested just to be safe. Now they're gone. One thing I have an issue with is the rapid test. They, from what my research is, they're 75% reliable compared to the PCR test. I mean, where can we stand with testing? I mean, some people can't do a PCR test because now the insurance companies aren't going to pay for them, and then you're going to have a copay and all this other stuff. So and then what I found out, someone had said to me in my congregation that they did a PCR test, it came out negative. Then they did a PCR test and it came out positive. So there's still some confusion with the testing. Can we elaborate on that?
Well, so the home test kits.
Yes.
You really as always, Pastor Best, you have the data and know more about this than 99.9% of non-medical people, and a lot more than a lot of medical people.
Thank you.
And so, yeah, but it's with the initial test, there's at least a 25% false negative occurrence.
Wow.
But if you then recheck, so you have symptoms, you're really worried about it, the first one's negative. If you then recheck, say 48 hours or so later, the likelihood, if you have COVID, that will become positive is quite high.
Okay.
So, you just may have to test more than once with the home test kit. Also, in addition, if you turn positive, it's very valuable to then retest to see when it goes negative, because seems to be a very reliable sign that you're not infectious anymore.
Right.
Magna, what do you think?
Yeah, I think the PCR tests are ones that are very, very sensitive, right? So they pick up even a small amount of virus. And so that's great in the early phases because, very early on, you might test positive and then okay, this is what it is. So I always tell people, if you do a home test and you have symptoms, same thing as what I said before, put your mask on if you've got to go out. If you don't have to go out, and it's stay home and don't expose people just in case. But the PCR tests also, because they're very sensitive, after you've really have stopped being able to give this to other people, they will actually test positive for a long time.
Yeah, I think 90 days.
Say that again?
I think 90 days afterwards, the PCR test will still pick it up.
It can be, yeah.
Wow. Wow.
So I just wanted to expand on the testing. Due to all the changes, Yale, New Haven Health are closing our testing sites, and the one in Bridgeport is closing this coming Friday. The walk-up tent.
Wow.
But you can get a COVID test at any of our blood draw stations, so you can still get a PCR test. And we have a lot of blood draw stations in the area, so you can still get one there.
Okay. Thanks, Martha.
Yeah.
Well, that's one I didn't know. But it seems as if, we're trying to find some type of way of living with this. Outside of the churches, we're going into, as Dr. Buller know, my favorite place, the gym. And I told Dr. Buller that I'm in the gym at 3 o'clock in the morning just so that I'm not around people. And I can literally count the people that are in the gym. But I still wear my mask. Should something like that still be considered, Dr. Buller, if you're in a place which is large and there's really nobody around? Is it okay for me to take off my mask at 3 o'clock in the morning when there's 8 people in the gym?
Yeah. I mean, I'll tell you what I do. And as you know, as I've said, I go real early to the gym. My gym doesn't open till 4:30, so I'm not there till then. But yeah, so I don't wear a mask now in the gym.
Okay.
And what I do is I wipe down the equipment, even
Yes.
though the data might suggest that actually COVID probably doesn't get transmitted very easily by just, services. But I wipe everything down. I use alcohol to wipe my hands off constantly. I feel like that's a reasonable approach to it, and I don't really have any risk factors. So overall, I think that's a reasonable approach, especially if you're in a wide open area with good air circulation and not very many people. I think that's the situation where not wearing a mask makes total sense.
Now, what about the grocery store or being in a large crowd like that? For example, the grocery store or the movies or going out to restaurants. What do you think about that, Dr. Diaz?
Yeah, I would say, for me, for the grocery store, it's a relatively short trip, right? I mean, usually maybe a half an hour or so. And it can be quite crowded, depending on when you're going, because for us, we're generally going on the weekends when we're not working.
Right.
And so, for me, it's an extra protection for me to just put a mask on. It's not for a very long time. I would say with the rates being low, I agree with Dr. Buller. I feel comfortable if it's a wide open space. I'm for a long time there, I didn't really go out to eat. I still supported my local restaurants by ordering food and bringing it home and eating at home. but I feel more comfortable now because I am fully vaccinated and
Mhm.
boosted, and and rates are low. So I think that it's a safe activity to do. But I think each person has to judge the risks in terms of their own health risks, and then also what the situation is, right? If it's it's hard to go to a restaurant and not wear, to wear a mask the entire time. So that one you kind of have to decide yes or no, right?
Yeah.
And I'm probably not as in good shape as you, Pastor Best.
Oh,
So
please.
so I try to go, I do a lot of actually outdoor hiking and, activities like that. And then when I go to the gym, I do try to go early in the morning
Mhm.
and, do it without a mask on.
We have a couple of questions that are coming in. And first of all, Martha has put in the chat, the blood draw stations will still do the PCR testing. And the first, I put in the chat as well. If there are any further questions, you can contact the Yale New Haven Health Call Center. That number is in the chat as well. So you guys can take care of that one. I'm going to get to a couple of the questions now. This came in from Pastor Anand. She is the new president and CEO of the Council of Churches. And she asked this question: what about large crowds and gatherings? My organization is seeking to host an in-person fundraiser with a minimum of 100 to 200 guests. And also her second question is, I have a health compromised daughter. That she's expecting, I wear a mask. Should she wear a mask everywhere because she's expecting? So those are her two questions.
Well, first, in large groups, is it inside or outside? If it's outside, I think the risk really drops down remarkably.
Okay.
If it's indoors and everybody's kind of packed in, like, so let's say a wedding, for instance, that it might last an hour or something, it'd be the same as if one is going to church. Those individuals who have a significant risk, they should be wearing masks. Individuals who really, don't have risks, have been fully vaccinated, and don't have worries at home, then probably not so vital at all. Now, again, if you have someone you're going to interact with closely, a family member who has significant immune system problems, you should be wearing a mask. It's really kind of that simple. Magna, have some comments?
Yeah, I agree. I mean, I think, if you're expecting, again, get vaccinated so that way you can give yourself the best protection that you can. And for sure, if you have a close family member who, I'm going this weekend to go see my in-laws who are both in their mid-80s. And so, yeah, are my husband and I more careful the few days before we go and more careful when we're around them? Absolutely. So, if tomorrow I started sniffling and coughing, I would cancel my plans.
We have another question that came in from one of my disciples, and she's asking, do we still have to be exposed before insurance will cover the cost? Are there any instances where they are free without pay or copay?
Is this, you mean COVID testing?
Yes.
I'm assuming that's.
Yes.
I actually don't know the answer to that. I don't know, Martha, maybe you.
I believe you have to have symptoms to have insurance pay, but I'm definitely not the expert in this area.
Yeah.
I mean, just like any of the services that are provided at our hospitals, if someone can't afford the care, they can go through our financial assistance process and fill out an application. So I would say that's the best advice I could give at this point.
So we should. I'm sorry. No, please go ahead, Dr. Diaz.
I believe I was taking a look at this because of the end of the public health emergency. It does look like our Medicare, Medicaid population is still going to be covered for testing. So I was glad to see that. But I think unfortunately each insurance company is going to take that question probably a little bit differently.
Right, right. We got another question that came through and it says, are there new symptoms of the newer strain of COVID? Is it a cold or is it COVID? How can we be sure?
That's a great question. I think that's some of the question that we've been struggling with all along, right? And I've had it happen where, because we automatically, test, we were testing all mothers who are coming in for delivery, where I would be having this conversation and they had tested positive. And I said, oh, did you have any symptoms? And they were like, yeah, but for like 4 days now, but it was just a cold.
Mm-hmm.
And so it is challenging to know. And I think that's the part that has made this hard, is the symptoms continue to be very similar to what we've seen all along. Runny nose, cough,
Right.
diarrhea are probably the most common.
Yeah, if you want to compare it to things like, influenza or certainly a common cold and allergies, the most recent variants do seem to have a bit more gastrointestinal effects. So diarrhea, nausea, maybe some abdominal discomfort. Those are things you generally are not going to see so much with influenza. You can, it's just less common. You're certainly not going to see them with a cold. You shouldn't. If that does happen, it's almost always the medicine you're taking for it. In addition, if you do experience a loss of smell or taste, that just doesn't occur again with a cold or with influenza or any of the other viruses to any extent except for COVID. Now, that being said, the incidence of those things happening with the most recent variants has dropped down tremendously. So it's really uncommon now to have a loss of taste or smell relative to, say, a year or so ago with Delta, for instance.
And I'm sorry.
Yeah. So testing, if you have a question, you probably want to get tested.
And this new variant that is out that I had mentioned earlier, it is not detected here in the States, correct? Am I correct on that?
Yeah, you're right. Not yet. Yeah.
Not yet.
Yeah. Yeah.
So not just because it's not here, because everything does go around. I mean, is that fair to say?
Yep, we're all one big atmosphere.
I think I should get a medical degree instead of a doctorate in ministry.
I agree with you.
What about long COVID? Can you talk about long COVID, please?
Right. So there may be lingering effects. Everyone identifies that can happen with COVID. So I'll start with the good news. The good news is that the vast majority of anything that we're going to call long COVID generally resolves by 6 months. As you go further and further away from the acute infection, the symptoms are much more likely to gradually, wane than persist. Now, that being said, there's the occasional person where it can be persistent, but the vast majority of the time, the symptoms will gradually disappear, usually by 6 months. So, 6 months to me is a long time.
Right.
What are the most common long COVID symptoms? Well, again, they're kind of like the usual symptoms of COVID, severe COVID itself, which are primarily pulmonary. In other words, lung stuff. You get short of breath, and that's the biggest of them. There are people who describe, of course, problems with thinking and memory. Brain fog. I'm not sure what you want to call it. Again, that looks like something that like the lung symptoms usually will gradually get better over time. People often are exhausted and have very poor energy levels. That's common when you have a severe illness that kind of puts you down to bed rest. You just don't know how much bed rest or just not doing anything affects your muscles and affects your energy level and your strength. And it takes a long time to get back to baseline. And that, whether that's long COVID or just the fact that you've experienced muscle atrophy and, maybe some lung effects, I don't know, but that'd be, one of the more common kind of identifications too. What is clear is that vaccination significantly reduces the incidence of long COVID. So if you're looking for something that if you get COVID is going to help prevent, maybe not entirely, but pretty close to entirely long COVID, long-lasting effects of COVID, it's vaccination.
Dr. Diaz, is there long COVID in children or in pediatrics? Does that still go into children as well? I mean, or is it just with adults?
No, it unfortunately does affect children as
Oh,
well,
wow.
to the point that we actually started a long COVID clinic at the
Mhm.
Children's Hospital to specifically follow these children. And there is ongoing research looking into, how we can prevent that from happening.
So one other thing I should mention here, I think, is the other thing that helps significantly prevent long COVID and complications of COVID that we haven't yet covered is when you do get COVID and you're in a risk group, there are medications that you can take now, right? And the one that gets all the publicity is Paxlovid.
Yes.
And just a very recent study, literally just published within the last week or so, looking at all sorts of different patient populations, those with immune systems and with normal immune systems, those who've been vaccinated, those who haven't been vaccinated, but who get significant symptoms and qualify for Paxlovid. Everybody did better, significantly better, every single group who got Paxlovid. There are other medications that are being developed and probably will be approved for use in the near future that, also makes you feel a little better about, okay, I'm not wearing masks for whatever reason, and I get COVID and I'm getting sick. There's Paxlovid, another medication that maybe is not as effective as Paxlovid, but still has some effect. And then some other medications on the horizon that we feel are going to be just as, if not more effective than Paxlovid. So there are treatments after the fact, rather than preventing it with vaccines. If you do get it, there are some medications that are very effective in people who are at risk for severe COVID.
Now, are these medications still the same with pediatrics, Dr. Diaz?
They're similar. We don't have as many medications in pediatrics as we do for adults. Some of the medicines that people might be on, for example, if you have diabetes and you're on metformin, that medicine seems to be having some evidence that that'll prevent you from make it less likely that you're going to end up having long COVID. That's not a medicine that we use very commonly in kids. So most of our kids aren't going to be on medicines, or would we necessarily treat them with those medicines to try to prevent it. So it is a little bit more difficult.
Dr. Bowler, you mentioned Paxlovid. Now, is that something that when you test positive for COVID, that the doctor would say, here, we're going to put you on this medication? The reason why I asked that question is a relative, and thanks around Thanksgiving, she was test positive for COVID, and they didn't offer her any type of medication. They just said to really nothing. Yeah. No, I mean.
So there's a whole list of people who would qualify for Paxlovid.
Okay.
Who qualifies? Well, it's people. So what you're preventing, again, is severe COVID requiring hospitalization, lung damage, things like that, being in an ICU, being on a mechanical ventilator, and death. So if you have, COVID that is relative, maybe knocks you for a loop, but not severely. You're not having any problems with your breathing. You just have, cough and fever and whatever. And you're not in a risk group, then there's no reason to take Paxlovid. Gotcha. Moreover, Paxlovid has a lot of drug interactions. In other words, if you're on certain medications, Paxlovid may interfere with those medications and vice versa. So we have to be very selective about who can get the medication, or then what we do with medications people are on. Do we have to stop them? Is that something we can do? So it's a selective process. Probably a majority of people who get COVID are not going to need to receive Paxlovid.
Okay.
It's only a minority, those people at higher risk.
Dr. Diaz, is there anything new coming out for pediatrics or for expectant mothers or anything like that, or anything that you haven't said that is important for them to know?
No, I mean, I think, unfortunately, again, we are doing research on this, looking especially about kids who have long COVID, and I'm hopeful that will, yield us some more tools in our toolkit for those kids. For expectant mothers, there's just a recent study that just came out talking about the protection, again, for moms who get COVID, but who have been vaccinated, that there's significant protection for that baby in terms of really no change in terms of outcomes if you happen to get COVID and were already vaccinated. So I think just more to add to that importance of vaccination.
I got another question that came through, and it says, many people are reluctant to take a third COVID vaccine. Will Paxlovid be the same as getting the vaccine?
No. No, it's very important to get boosted, and especially taking advantage of the kind of dual action vaccine that's the most recent one released. It is probably superior to your basic vaccine, although they're all very, very effective. I've had 5 shots, so
I'm right behind you. I got 4.
Yeah, I never really had any significant problem. The vast majority of people, you're gonna have some pain where you get the shot, and you might not feel great for the next day maybe, but it didn't prevent me from going to the gym and doing what I always do there after I got the shot. I mean, it just when the next one comes out, I will absolutely get it myself. It's just like a flu shot.
Right.
COVID will, just like influenza, it's almost certainly always going to be with us.
Right.
So we're going to have to analyze what the variants are and how to then go about getting vaccinated. By far, that's the best way to prevent all the bad things that happen with COVID, long COVID, hospitalization, etc.
Now, I know that, well, no, I'm sorry. Let me take that back. I don't know if you can answer this question, but what is the origin of COVID? How did this happen? Dr. Buller's laughing.
Yeah, Magna, that's your question.
I mean, I think that's something that is, of course, there's lots of theories on how that happened, right? So, and I don't know. I think most of the evidence is that this was probably an animal transmission, that there was an animal that was infected, and a lot of these types of viruses, that is where it comes from, hence the name monkeypox, which then had to be renamed. A lot of times these viruses will start off in animal hosts and then, move on to humans. And if you look at least the TV documentaries and the pandemic shows that have come out, a lot of people, and reliable scientists who are talking about what's the worries for the future. Right. That's what the worries are. And so, I don't think that anybody has shown any evidence that this was lab grown or intentionally created. Will we ever know the answer to that question 100%? Probably not. But I'm not sure that that's worthwhile in terms of my time to debate, because I think the most important thing is, for me, I'm a very practical person. It's like, okay, this is what I'm dealing with.
Right.
Make sure I protect myself, protect my family, and be able to enjoy.
How can we, as a community, stop the noise and the false theories that we hear, and just really, I don't want to say accept things the way they are, but to know what the truth is about moving forward and where we're going from here with COVID? I know people are going to say, well, this person told me this, and this person said I grew an extra finger, and I have all these bumps on my head now. How can we actually get people to say, you know what, here's the data, this is what's really what we're looking at here?
I think barring them from the internet is probably the worst thing. There are individuals who you're never going to change their mind, and
That's true.
Pastor Best, we've had this discussion before.
Yes, sir.
And I don't think it's changed. I think it's still, there are people who are very dead set, and vaccines are, in general, not good. Like, there are anti-vaxxers all over the all over the place.
Right, right.
To me, that's very scary. That's the scariest part, especially their children not getting vaccinated.
Right.
And then you have, conspiracy theories about, various things. And again, sometimes, as Dr. Diaz was mentioning, I don't think any of us will know for sure about the origin of COVID. So there's maybe a conspiracy theory that's, going to be hard to disprove at any time, I guess, because some government agency even said, yeah, it looks like this may have come from escaped from that lab in Hunan, but who knows? But yeah, some stuff that has tremendous scientific data to support it. If people simply are not going to listen to the experts in the area, then I don't know, what you can do.
Right.
Yeah,
Yeah.
no, I think the thing is that I live in the world of pediatrics. I deal with moms and dads who've got anxieties, who are constantly part of networks, who are, talking about things. And, for years, people will say, well, if my kid eats this, then will they, and so I don't mind people asking questions. I think it's good for people to ask questions, but I think the important piece of when you're asking those questions is who are you asking them to, right? So find somebody that you trust. Like for me, for your pediatrician, for me as an adult, my primary care doctor, I want to find somebody who I trust, who I feel like I can ask these questions to, and who I trust enough to believe them when they talk about it. I think the other pieces of it is things like this, Pastor Best. I mean, I think that the fact that you're having this discussion, bringing it to the congregation, being able to have people be able to ask those questions and have trusted sources of information, be able to answer those questions, that's where we're going to make changes, right? We've got to be part of the networks. We got to be part of the community to be able to have these conversations.
Well, I think we've been doing this for a while now, and you said talk to people that you trust. That's why you and Dr. Buller are my team. I mean, if there's a question I get with Martha and send it out to you guys. And I really would like to, as I preach, I study when I preach, and before I can bring any type of medical information regarding COVID to my congregation, I bring it to Dr. Buller. And I probably sent him 3 or 4 emails sometime earlier during COVID. He's just stop sending me these emails. But I got the information that was required to give to the community, because some people will not go to a doctor. And the next thing that they have is their pastor. And if I get the information and I get the correct information and I can dispense it to my congregation, then they can dispense the correct information to their families. So that's what I try to do. I'm not trying to be a medical doctor or try to be better than anybody else. I have to look out for my congregation, and my congregation is the community of Bridgeport. So that's why I do what I do.
Well, the vast majority of healthcare workers have no hidden agenda. The only agenda is to help their patients.
Right.
Help maintain the health of the greater Bridgeport area, patients, population, what have you. That's our only agenda. So we're going to go with the information that we, after many years of training and continuing medical education, that we believe to be trustworthy. And it is a bit disconcerting when people don't recognize that, and they think, doctors might have some kind of hidden agenda. But I don't know what we could possibly have. We just want to do the best that we can for our patients. Pretty simple.
Exactly. Martha, you had anything to add?
I have one final question.
Yes.
Do you think that COVID will be with us forever? And do you think that we're going to see an increase in the fall and the winter?
Yes and yes. I don't know, Magna, what do you think?
That was easy.
Yeah.
I do think, just like Pastor Best said, I think that we will, what happens moving forward partly will depend on what, these new variants. And, I think if we see a huge surge in Europe, which we haven't with this new variant, we've, seen a tiny little bump, but not any big, huge thing like we saw in January, 2022 with Omicron. I think then I'd be a little bit more worried. I'd be looking to see, can I get that booster a little bit sooner? But the good thing is we have had, the pattern has been, there have been other countries that have had the surge before we do. So we've had a little bit of ability to predict. So that's helpful. Do I think that the thing that's going to drive a little bump in the fall is going to be gatherings, right? It's that time where we're indoors and we want to be with our families, and that's what's going to drive that little bit of bump. So I think yes. Will this be with us forever? I think it'll be with us for a while. And there have been other epidemics that have happened where it's been with us for 5 years and then it just seems to go away. Do I pray to God every day? Yes, I do. That will happen? Yes, I do.
I tend to think this is more like influenza and, just things we can't cure. You can cure some things with vaccine. You can cure polio. You can completely prevent it. You wipe it, smallpox, you completely wipe it out. But obviously we can't do that with influenza because it mutates and we have different subtypes. And that's what's happened with COVID. So I'm very pessimistic that it's going to just go away. But hopefully you have enough ongoing immunity and then enough really effective vaccines that we can reduce it to literally kind of like having a cold. That would be, my vision, but who knows exactly what's going to happen. It's like predicting the future for anything,
Well, Dr. Diaz and Dr. Bowler, I want to thank you very much for participating in this town hall. Once again, Yale New Haven COVID call center, the number is 833-275-9644. For any questions regarding tests, vaccines, etc., call between the hours of 7 a.m. and 7 p.m. During the week. And Dr. Bowler, once again, Dr. Diaz, Martha, I want to thank you guys for working with St. Matt's as we work through this COVID and trying to find out where we're going from here. And
well, thank you, Pastor Best.
Thank you.
People like you that keep this in the public eye. And, again, your only agenda is trying to do the best thing you can for your congregation and the people of Bridgeport. And we very, very, very much appreciate that.
Well, I appreciate the partnership that we have. I mean, it's an unspoken partnership, not written down, but I just like working with the three of you, and I'm glad that I have the outlet to be able to ask the medical questions for the congregation. Anyway, thank you guys very much. Martha, Dr. Diaz, Dr. Bowler, thank you very much and have a great evening, and we'll be in touch.
You too. Bye,
Okay,
everybody.
bye-bye.